You want to get a real grasp on what makes healthcare tick.
Right.
To understand how hospitals and clinics are, constantly trying to get better, safer. Well, today we're plunging into a core concept in that world: multidisciplinary quality teams.
Exactly. And think of this as, well, your shortcut to understanding how all that diverse expertise actually comes together to drive improvements.
Yeah.
We've basically synthesized insights from big players like Joint Commission International, the National Accreditation Board for Hospitals and Healthcare Providers.
NABH.
Right,
Europe.
NABH. And also practical perspectives from places like Supreme Medic Consultancy, ISQA, that's the International Society for Quality in Healthcare.
Okay.
And we've looked at articles, even another podcast script discussing these teams.
So a pretty wide range of sources. Our aim here then is to go beyond just sort of defining these multidisciplinary quality teams, MQTs, let's call them.
MQTs, yeah,
Yes.
good shorthand.
And really explore why they matter so much in modern healthcare. And crucially, how they actually work on the ground to make things better, quality, safety, all of it.
That's the plan.
Okay, so to kick things off, fundamentally, what is a multidisciplinary quality team?
Well, in essence, it's a team that's purposefully put together. It's got professionals, but they come from different backgrounds, different roles.
Okay.
And they're all working together on a shared goal: improving quality, streamlining processes within, say, a hospital or a clinic.
Right.
It's really about harnessing that collective wisdom, you know, using all those different skills to tackle complex problems.
So if we could be a fly on the wall in one of their meetings, who would we likely see there?
Good question. You'd probably see quite a mix.
Huh.
Doctors, obviously, bringing their clinical know-how. Nurses with their deep understanding of patient care, how things actually flow day to day. Pharmacists looking at medication management.
Right, meds are huge.
It's huge. And you've got administrative staff. They bring the operational insights. And often, quality improvement specialist people trained in the actual methods for making change happen. That picture came through clearly in that podcast script we looked at.
So it's like getting all these different professional lenses focused on the same target.
Yeah.
And the overarching aim. What's the big goal they're shooting for?
The main goal, really, is to use that rich mix of expertise for, well, more complete problem solving.
Okay.
By bringing all those perspectives together, MQTs can create and roll out solutions that actually lead to better patient outcomes.
Right.
Like one source we saw, Indeed.com, highlighted how this holistic approach, looking at the whole patient picture, can lead to, say, more accurate diagnoses or better treatment plans.
Interesting.
And what's really fascinating, I think, is that the real power isn't just having different viewpoints in the room.
No.
It's about creating a shared understanding of the patient's journey, So the solutions address how clinical stuff and operational stuff are all interconnected. That often gets missed when departments work in their own silos.
That makes perfect sense. Yeah, instead of just like the pharmacy trying to fix a pharmacy problem in isolation.
Exactly.
You've got this integrated approach. So why is this so critical? What's the real payoff for having these NQTs?
Well, one of the biggest advantages is that holistic problem solving we just touched on.
Right.
Like the podcast script showed, complex healthcare issues, they rarely fit neatly into one department's box.
True.
Think about patient discharge times. Getting that right involves a lot.
Definitely.
An MQT can look at clinical readiness. Is the patient medically okay to go home? That's the doctor's view. But also the logistics, paperwork, transport, that's admin. And does the patient understand their meds, their follow-up? That's nursing, maybe education.
So it's a full 360-degree view.
Exactly. A view that one department on its own might totally miss.
So a big part of it is breaking down those internal walls, those silos, and improving communication.
Precisely. MQTs are really instrumental in fostering better collaboration, better communication across different areas. They create these spaces, dedicated forums for that cross-functional chat. And that, as both the podcast script and Physiopedia mention, helps build a more cohesive culture in the organization.
Right.
People who might not normally talk much are suddenly working together on the same problem.
And I can imagine that kind of cross-pollination of ideas, that must spark some real innovation, right?
Absolutely. When you bring together diverse skills, different ways of thinking, like the podcast script emphasized,
Yeah.
it just naturally sparks creativity. You get solutions that maybe wouldn't pop up in a group where everyone has the same background.
And it sounds like it's about making changes that actually last, not just a quick fix that fades away.
Exactly right.
Yeah.
Because you've got representatives from all the relevant departments involved from the start.
Right, you're in the room.
They're in the room. So there's more buy-in, more ownership. The solutions they come up with feel more practical, more relevant to the people who have to implement them.
Okay.
And that means they're more likely to be accepted and crucially sustained over time. The podcast script really hit that point hard.
And they're looking at quality from all angles, not just one aspect.
That's a key point. MQTs are designed for comprehensive quality insights. They're looking at patient safety, clinical effectiveness, is the treatment working, cost efficiency, are we using resources wisely, and of course, patient satisfaction, all of it.
And this ties back to what those big organizations like JCI and NABH are all about, doesn't it?
It really does. You look at their websites, their missions, it's all centered on quality improvement, patient safety. MQTs are basically a vital tool for hospitals and clinics to actually meet and maintain the tough standards set by these accrediting bodies.
So the standards aren't just paperwork.
Oh, not at all. They're not just about ticking boxes. When those standards are put into practice through effective MQTs, they really act as a framework. They help build a healthcare system that's resilient, one that's constantly learning.
Okay.
Think about JCI's vision, zero harm. That directly reflects what these teams are ultimately trying to achieve.
Okay, so we see why they're important. But how does a hospital actually, build one of these teams and make sure it works well? It can't just be throwing random people together, surely.
Definitely not. No, the first critical step, as that podcast script detailed, is being really careful about identifying the right team members.
Right.
You need a balance, a mix of people bringing different but complementary skills and viewpoints.
So who's usually in that mix?
Well, often you'll have clinicians, doctors, nurses, but just as important are people from operations, maybe technical folks from IT, and support roles too, like patient advocates. Getting that well-rounded perspective is key.
Okay, you've got the team. What's next? Roles.
Exactly. Once the team's assembled, defining roles and responsibilities really clearly is paramount. Everyone needs to know exactly what they're contributing to the shared goals.
Right.
The podcast script had a good example.
Yep.
Maybe the data analyst provides the key metrics, the numbers,
Okay.
while a clinical leader gives insight on what those numbers mean for patient care protocols.
Yeah.
That clarity avoids duplicated effort and makes sure everyone's accountable.
And the team needs a clear target, right? A direction.
Absolutely essential, setting clear goals and objectives. The podcast script mentioned SMART objectives, specific, measurable, achievable, relevant, time-bound.
The classic SMART goals.
Exactly. Whether the goal is, say, cutting patient wait times in the ER or improving medication accuracy, having those well-defined targets keeps everyone focused and, pulling in the same direction.
Now, you've got all these different professionals. Communication must be absolutely vital.
Yeah.
And maybe tricky.
Oh, it's vital, and yes, it can be tricky. Fostering collaboration and really open communication is key.
How do you do that?
Well, you need an environment where everyone feels safe to share insights, to maybe constructively challenge assumptions.
Even challenge senior people.
Ideally, yes.
Yeah.
And engage in regular, transparent dialogue. Both the podcast script and some insights from LinkedIn really stressed having regular meetings and clear ways to give feedback.
And maybe it helps if everyone's using a similar toolkit for improvement.
Precisely. Providing training in specific quality improvement methods can be incredibly helpful.
Like what?
Things like PDSA cycles, Plan, Dose, Study, Act. It's a simple but powerful way to test changes iteratively. Or maybe Lean Six Sigma, which is more data-driven, focused on cutting waste and variation.
Okay.
Having a common framework like that gives the team shared tools, a common language to tackle problems consistently, regardless of their individual disciplines.
Makes sense. And finally, how do you know if it's all working? If the MQT is actually making a difference?
Right. You need to track progress. Monitoring progress and, importantly, celebrating successes are crucial for keeping up momentum and engagement.
Celebrating wins.
Absolutely. Tracking those key performance indicators or KPIs, recognizing when milestones are hit, celebrating even the small wins. It reinforces the value of the team's work.
Keeps people motivated.
Exactly. It
Right.
encourages continued effort and commitment. That podcast script really highlighted the importance of that feedback loop and positive reinforcement.
We've talked about the general idea of the team mix, but let's get more specific. Who are the key players you typically find in a healthcare MQT, and what are their main jobs?
Yeah, our sources gave a really good breakdown of the core members. Often, leading the charge, you'll have a quality manager or maybe a head of quality.
Okay, the leader.
Right. This person guides the MQT, develops the improvement plans, makes sure the hospital is meeting accreditation standards like NABH and JCI, and they're keeping a close eye on those KPIs, those performance indicators.
So kind of the conductor of the quality orchestra. What about clinical leadership?
Crucial. You'll have a medical superintendent or maybe the chief medical officer, the CMO. They provide that essential clinical oversight. They help get clinical quality initiatives off the ground and support things like clinical audits. And similarly, on the nursing side, the nursing superintendent or head nurse focuses on nursing quality, safety protocols, training, incident reporting for nurses.
Got it. And infection control, that's always massive in hospitals.
Absolutely non-negotiable. So the head of infection control is a vital member. Their job is to constantly monitor infection rates, especially healthcare-associated infections.
HAIs, right?
HAIs, exactly. They implement and oversee infection control guidelines, and if an infection does occur, they lead the deep dive, the root cause analysis to figure out why.
And all this quality stuff generates a lot of data, I imagine.
It really does. And that's where the quality data analyst comes in. Their role is critical. Collecting, carefully analyzing, interpreting all that data.
Turning numbers into insights.
Precisely. They create the reports, the dashboards that give the team the evidence they need to make smart decisions.
What about medications? Ensuring they're used safely.
Key role for the pharmacist or the head of pharmacy. They're vigilant about monitoring medication errors, promoting overall medication safety practices across the board.
Okay.
And they participate in audits to make sure pharmacy services are up to standard.
And hospitals rely so much on equipment these days.
They do. So the biomedical engineer is essential. They ensure all the medical equipment is properly maintained, calibrated.
Working correctly.
Exactly. And they report any failures immediately, anything that could impact patient care or quality.
It's not just the clinical side, though, is it? The staff themselves need support.
Absolutely. The head of HR plays a surprisingly important role here. They support staff training, check competencies, help build that quality and safety culture throughout the organization, and make sure performance reviews line up with quality goals.
And someone specifically focused on preventing patient harm.
That would be the patient safety officer. Their core job is monitoring incident reports, near misses.
Learning from mistakes.
Learning from mistakes, exactly. Conducting thorough root cause analyses, or RCAs, to understand why things went wrong, and promoting that safety culture everywhere.
What about the overall running of the hospital, the non-clinical side?
That's where the operations manager fits in. They make sure all the support services think housekeeping, food, transport are aligned with the quality standards.
Right.
They work on optimizing workflows for efficiency and keep an eye on patient satisfaction with those crucial background services.
And the tech backbone, the IT systems.
Vital. An IT representative supports the data systems, the electronic health record, making sure the data the NQT relies on is accurate, secure, and accessible. Data integrity is key.
And I guess someone has to watch the budget for all this quality work.
You guessed it. A finance representative monitors the cost effectiveness of these quality programs and ensures everything stays financially compliant.
Okay, that covers a lot of the leadership and support. But what about the people actually doing the patient care in different departments?
Absolutely critical to have them involved. You need clinical department representatives.
From where?
From various specialties, surgery, medicine, pediatrics, OBGYN, you name it. They're crucial for spotting quality issues specific to their areas.
Okay.
They lead improvement projects within their units and act as that vital communication bridge between the main MQT and the frontline staff.
We also saw mention of optional members or supportive roles. Who might they be?
Yeah, depending on what the NQT is focusing on, you might also bring in others. Maybe a legal advisor for compliance issues, an accreditation coordinator to handle the paperwork for JCI or NABH.
Okay.
Maybe the dietitian if nutrition standards are a focus. Perhaps a dedicated patient experience officer looking specifically at patient feedback.
Radiology. Lab.
Could be. Heads of radiology or lab services if diagnostic quality is key. A training officer for specialized QI workshops. Even internal auditors sometimes provide independent reviews.
So it's a really flexible structure. You tailor it to your needs.
Exactly.
Yeah.
It's adaptable.
Now, looking at the MQT as a whole unit, what are their big picture responsibilities? It's more than just the sum of those individual roles, isn't it?
Oh, definitely. As a cohesive team, their job is ongoing. They're constantly monitoring those KPIs we talked about.
Right.
They hold regular quality review meetings, assessing progress, spotting new challenges, celebrating wins. They're also tasked with developing and actually implementing specific quality improvement projects, or QIPs,
To fix problems.
to proactively address areas needing improvement. Yeah.
And when things do go wrong, incidents.
They manage the incident reporting process and, crucially, lead those root cause analyses to really understand why and prevent it happening again.
Okay.
Supporting the hospital's accreditation journey, getting accredited, staying accredited with bodies like JCI and NABH, that's another core function, often with help from consultants like Supreme Medic.
Sounds like a huge job.
It is. And it really needs strong backing from the top, encouraging staff engagement in that quality culture.
Getting everyone involved.
Everyone involved, ensuring there's ongoing training, building capacity, and finally, MQTs often do benchmarking, comparing their performance against industry standards to see where they stand and find more opportunities to improve.
We know MQTs can be really effective, but like any team effort, I assume they hit bumps in the road. What are some common challenges they face?
Yeah, that podcast script we looked at pointed out several common ones. One boogie is conflicting priorities.
How so?
Well, different departments or professional groups might just have different goals or see solutions differently. Admin might focus on efficiency numbers, while clinicians are zeroed in on patient care nuances.
Right. Different pressures, different perspectives. What else?
Miscommunication is another potential hurdle, especially with people from diverse backgrounds. They might use different jargon, have different communication styles. Time constraints are almost always an issue. Team members have their demanding day jobs, plus the MQT work.
Finding the time is hard.
Very hard. And lastly, power imbalances can sometimes be a problem. Differences in seniority or hierarchy might stop some people from speaking up openly.
Okay, those sound like real obstacles. Are there good ways to tackle them? Strategies MQTs can use?
Yes, definitely. And the podcast script offered some solid strategies. For conflicting priorities and miscommunication, fostering really open, transparent communication is vital. Setting clear communication rules, encouraging active listening, really making an effort to understand different viewpoints. For the time issue, effective time management strategies are key.
Okay.
And to deal with those power imbalances, you need inclusive leadership. Leaders who make sure every single member feels valued, respected, and truly heard.
Creating a safe space.
Exactly. Creating what they call psychological safety, where people feel comfortable voicing opinions, even challenging the status quo. That unlocks the team's full potential.
Okay, let's try and boil this all down. If you had to pick the absolute key takeaways for our listener about these multidisciplinary quality teams, what would they be?
Right. Key points. First, remember, MQTs are fundamentally about bringing together that diverse group of professionals.
The mix is crucial.
The mix is crucial. Everyone bringing their unique expertise, working collaboratively towards shared, clear, quality goals. This integrated approach allows for comprehensive problem solving that, honestly, no single person or department could manage alone.
And it's not just reactive, fixing problems.
No, not at all. These teams are vital for fostering better collaboration, better communication across the whole organization.
Right.
And that doesn't just spark more innovative solutions because you have all those perspectives. It also leads to improvements that actually stick because everyone involved feels that sense of ownership.
So for a hospital wanting to set up or improve their MQTs, what are the absolute must-dos?
The critical steps are, 1, carefully selecting the right team members, get that mix right. 2, setting clear, measurable goals everyone agrees on. 3, actively fostering open, respectful communication. And 4, providing training in those quality improvement methods so everyone has the tools.
And expect challenges, but have ways to deal with them.
Exactly. Be realistic. Expect things like differing priorities or miscommunication sometimes, but know that with strategies focused on open dialogue, clear rules, good time management, and inclusive leadership, you can overcome them.
And ultimately, this work fits into that bigger picture of healthcare standards, right?
Absolutely. The hard work of these MQTs directly supports the mission and the standards set by accreditation bodies like JCI and NABH.
Okay.
Those organizations provide the framework and the recognition for hospitals that really commit to continuous quality improvement and, most importantly, patient safety.
Well, thank you. This has been a really insightful deep dive into multidisciplinary quality teams. I really hope that you, our listener, feel you've got a much clearer handle on this, this vital piece of the healthcare quality puzzle now. Hopefully a good shortcut to understanding it all.
My pleasure. And yeah, understanding how these teams are built and how they function, it really gives you a window into how healthcare organizations are systematically, proactively trying to improve all the time. Striving for safer, better patient care which is exactly what groups like JCI and NABH champion worldwide.
So here's a final thought for you to chew on. Think about all that diverse expertise packed into one effective MQT. What truly groundbreaking solutions could emerge if those different minds really clicked, collaborated seamlessly on a really tough healthcare challenge, maybe one you've seen in your own community or even experienced yourself. Just consider the potential there, the potential for real leaps forward in patient care and safety when that collective brainpower is truly unlocked.